Ladies, men, if there's a part of your body you are not confident about, you can change it. It's easy as that. I'm here today with Dr. Ward, and Dr. Ward, you're a facial plastic surgeon, but you guys are actually, you're broadening and you're doing body plastic surgery now here.
Yes, so we are so excited. At the end of the month, we have Dr. Kordestani joining us, who's an amazing plastic surgeon, 20 plus years of experience. He is a big mountain guy. He's been in Texas with a great practice, but he is ready to move to the mountains. And we were so happy to be able to snatch him up to offer these services for our patients.
Good. And so you guys just happened to connect with him, and you know that he comes with a great reputation. So you basically like handpicked him.
Yeah, so in a totally kind of funny thing, he is like a really close friend of a close friend of mine, like a surgeon that I trust and know. And he's like, if he wants to come, like, snatch him up, don't let him go. So we did.
Good, and he's going to be happy here. I think that's what's great, you know, a doctor that wants to be in their certain environment, they're going to be happy too.
Right.
So let's talk body plastic surgery. A lot of people do it. There used to be a lot more shame and people would not talk about it. Now people are like, here's what I had done, and they're posting all over social media.
It is not something that people are ashamed about anymore. I mean, there still are some people,
of course,
but overall, it's not. Like, people are just happy to have the body they want. They don't care if people know how. They just want to feel better. It's not about like what other people think. It's about what you think and what you feel on the inside. And that is actually the really cool thing about what we do. You know, I do face only, but what Dr. K does, it's about making people feel confident. So whether it is, you know, getting rid of the love handles, whether it's getting rid of that belly fat. And by the way, I should point that out. Those are the two areas that I don't like about me.
I was going to say,
as a man.
Not everyone.
But I think the reason that that's so important is, like, it doesn't matter. Like, we want to just kind of look good and feel confident. It's about feeling confident, and that's what these sorts of procedures do.
And I think you just said the key thing. You said, I don't like those as a man. Men have the same issues as women do oftentimes, and it's okay if they want to have something taken care of. So as far as how it would be taken care of, what kind of procedures? Would it be non-surgical or always surgical to do these?
So Dr. Kordestani, you know, knows about all the different types of procedures, but he focuses primarily on surgical. So he does mommy makeovers, breast augmentation, breast lift, liposuction, abdominoplasty, you know, which is like if you've got saggy abdomen, you've got extra fat there or whatever, gets rid of that, gets rid of the love handles, sculpting of the legs, sculpting of the arms, just to kind of get people to feel best. But he also incorporates that with our overall theme of trying to take care of the whole person, both internally, going out to the skin. It's important to address everything.
Oh, absolutely it is. When you say sculpting of the legs, what are some of the things that people do?
So liposuction is the probably the number one thing. But other things that people do are, like, if there's this excess skin, you can remove it. So,
and that could be for somebody that's maybe lost a lot of weight, right?
Sure. And that's actually one of the things that Dr. Kordestani really specializes in is post, you know, say like gastric bypass, people who have a lot of excess skin. Just getting rid of that, making them kind of get back to normal. And
you also said that it is about the overall. It's everything. It's not just the appearance, but let's be honest. If you feel good in your outfit, if you have makeup on versus no makeup, you know, there's different times we walk out into public holding ourselves a little bit higher.
That is exactly. It is not about how you look in the mirror necessarily. It's about how you feel. So how we look in the mirror certainly affects how we feel.
And it crosses over.
Exactly. But it's about how you feel. It's not about vanity.
What I really love, though, that you guys are doing is you're doing this transformation so that they can really change the way they eat. You know, you're coming in, you're paying for this surgery. You might as well go home and eat well, exercise, all of that.
For sure. So I am a big believer that the number one thing we can do for our patients is make them feel their very best. Of course, we want them to look their best, to feel their best, but part of that starts on the inside. And I think it's, you know, kind of up here. So that's why every one of our patients actually gets some life coaching as well, because our happiest patients are the ones that use this as an opportunity to change their life and feel their very best.
I love it. So let's talk if they want to, you know, come in. As far as the consultation goes, that's probably for some people, they might be nervous about this. How does the consultation work?
So they typically will talk with one of our patient coordinators, find out kind of what's best for them, meet with a surgeon, get scheduled for surgery, and get it done.
And they're all very nice, I promise. So I've been here, done that. I've done laser treatments and all sorts of stuff, and it makes you feel better. So thank you so much to you and your team, and congrats on the new doctor.
Thank you.
You can scan this QR code. It'll take you right to the website so you can learn more and schedule a consultation.
Utah friends,